Chill.
Okay. Fine. So good morning, everyone.
Good morning, madam.
Good morning. Well, I'm Deepthi Maheshwari. I work as a marketing manager for oncology department and also for medical devices. I look after the domestic market, and of course I help even in training and marketing aspects with respect to export also, right? So
Yeah.
you might be knowing Mr. Abhay Verma, who is the export manager. So whenever required, I help him out and provide marketing inputs. Whenever required, I give training for export also. Okay.
Okay.
So I'm basically a postgraduate in analytical and medicinal chemistry. I've done my MSc. I've also done my business administration management. Okay, I'm in the industry for last 20 years. I have experience of working in multinational companies like Ferring Pharmaceuticals. I've worked for even the leading pharma company of India, Sun Pharma. And of course, the maximum time I have spent is with Khandelwal Laboratories. Okay, so that's my background. And I wanted to know how many of you all are there now for the training? How many people are there?
Nine.
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 Nine of you all. Okay. But tell me, you are going to stand like this and take the training, or you want to sit and be comfortable?
Okay.
Is
Madam,
there a big screen?
we are fixing it, madam.
Asha, that will take some time.
Yeah, maybe.
Who's doing that?
But there is a man who fixed it, so you can continue by this.
So you want me to stop now?
No, start.
I
You
can
can
start.
start.
Okay, fine.
Yeah.
So there are nine people, and I think some of you all were there for the previous training also. Last time when
Sorry.
I had taken a training program for Ethiopia people a few months back. So
Yeah.
some people are still the same, or this group is a new group?
There is we are new group.
New group. Okay,
Yeah.
okay. So this is a totally new group. You all are taking training for the first time, right?
Yeah.
Now, can I get some background about you all also?
Okay.
Like what is your qualification, and like you all are science graduates or B farms or what, like?
Yeah. Okay. Let me start with
Yeah.
me. My name is Mamush. I'm graduated from Medical Hospital or Kotabe Metropolitan University with BFAR.
Okay.
Uh,
And how much the work experience you worked with? Which type of companies?
I'm fresh graduate.
Experience. You're a fresh graduate.
Yeah.
Okay. So, pharma industry is you're going to work for the first time in the pharma industry, right?
Yeah.
This is your first job.
Yeah. This is my first.
Okay. Good. All the very best. Next. Who's next? Yeah.
I am Fozia Fedru. I graduated from Kotabe Metropolitan University in Medical Hospital. And I'm a fresh graduate. So I started in this company. It means I'm a fresh employee.
You're a B firm? You're a B firm?
Yeah, I'm a B farm graduate.
Okay. I didn't get your name.
I'm Fozia.
Pooja.
Oh, F.
Pooja.
Start
Okay. Fine. Pooja. Okay. So you are also a fresher and a B farm graduate. Great. All the very best. Yeah. Who's next?
This is year starting semester. I'm a fresh
I didn't get
graduate.
your name. I didn't get your name.
Year starting.
Once
Year
again.
starting.
Just 1 second. E.
Y.
Huh?
E.
Huh? E-Y-E.
R.
Huh?
R.
Uh-huh.
EYER.
Huh?
U.
Yeah.
S.
Okay.
And I am a fresh graduate with a background of B Farm.
Acha, you're also a fresh graduate and you're a B Farm. Okay, great, 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 great. Welcome, welcome. Yeah, who's next?
Hello.
Good morning.
Good morning. My name is I have graduated with
I get your name once again.
Aylan.
Alan.
Yeah. H-E-L-E-N.
Okay, H-E-L-A-N. Fine, Helen. Fine, got it, got it. Yeah.
I have graduated with a B Farm a year ago, and I've worked in the dispensary for about a year.
Fine. Okay, you worked in a dispensary. So this pharma company, this is your first pharma company, right?
It is the first time.
Okay, great. Who's next? Welcome to this training program.
Hello, madam.
Yeah.
My name is Rahmat.
Muhammad.
Rahmat.
Okay.
Yes. I graduated with clinical pharmacy.
Okay. You're also a
I'm fresh
B-Farm?
graduate.
You're also a B-Farm?
Yes.
Okay. Good. So you're also a fresher. Good. Welcome, welcome to this training program.
Yes.
Who's next? Good morning. You're muted. Yeah. Yeah.
Okay, my name is Ephraim. I was graduated from Ethiopia Health Science College with B Farm.
Yeah.
I'm a new employee in this company.
From how many years? Or from how long?
I'm a
From
new
when?
fresh.
Actually, you're
employee.
also a fresher. Okay, 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 okay. Great. Anyway, welcome for this training program. Yeah. Ephraim. Yeah.
Yes.
Hi.
My name is Ismail. I'm
Okay.
fresh graduate for the data, and do you hear me, sir?
Yes, yes, I can hear you.
I'm a Badlag employer, fresh new employer.
Okay. Yeah, new employer. You're also a B-Farm graduate and a fresher.
I am
Okay.
a promoter from Badlag Private.
All the very best and welcome to this training program.
Yes, thank you, sir.
Hello,
Yes, hi.
my name is Tashan.
The Shashant.
Yeah.
Shashant, okay. Yeah, Shashant.
Tashan.
Yeah.
I am one of senior medical researcher.
Okay. You're also a bee farm?
Yes.
You're also a bee farm? You've done your bee
Yes.
farm?
Yes. Yes. Yes.
Okay, okay, very good. So you have 1 year experience, yeah? Okay, great. So welcome to this training program. Yeah, who's next?
Hello,
Yeah, that's all.
my name is Mother.
Mother.
Yeah,
Okay.
I'm new. I'm a new employer in a private company.
You're also a BPharm graduate?
Yeah,
Okay, great. Great. So all BPharms here, right?
yeah.
Anyone is remaining? That's it?
No.
No.
Yeah, that's
Okay, great. So we have 1, 2, 3, 4, 5, 6, 9 people, right? Great. Okay, fine. So I think we'll start.
of course. You can start.
You able to see my slides?
Yeah.
Okay.
Is that it?
You all have switched off your videos? I can't see you all. Hello? Hello? I can't hear you all. Keep your videos on, okay? You're muted, you're muted. Yeah. See, while I'm taking the training program, please keep your videos on, okay? Yeah. And you can keep yourself muted only if you have any doubts or queries, then you can unmute yourself. Hello, is that clear? Keep your videos on and keep yourself muted when I'm taking the training program. Only if you have any query, then unmute yourself, okay? Is that clear? Yeah. Okay. So basically what I can see is all of you all are BPharm graduates. So understanding the subject will of course not be difficult. Okay, so you all can understand what I'm going to teach today. And this is your first organization and that you're working for oncology. So basically I'll just give you some idea. There is a difference between the pharma products and the onco products or the cancer products or chemo products. Yeah. So all of you all have joined in the company where you are going to promote the cancer products, right? Now, the study of cancer is called as oncology. So basically, you're in the field of oncology, and we are going to be seeing all the products which are going to treat cancer, right? So these are basically chemotherapeutic drugs. Some might be targeted therapy, some might be hormonal preparations, some are oral, some are injectables. Yeah, but there is a difference between promoting pharma products and oncology products. In pharma products, generally what happens is you have the set indications and you have the calculated dose for each indication. Whereas in oncology, it is different. In cancer, it is different. For each patient, the dose varies, right? So why it varies, how it varies, I will explain you all that. Now, the field or the study of cancer is, of course, called as oncology, right? The doctors who treat cancer are called as oncologists, right? And in oncologists also, you have medical oncologist, you have radiation, you have hemat, and you have surgical oncologist also. So, what is the role of each and every oncologist? I will explain you all. But before we go into the depth of all this, first let's understand what is cancer, why it arises, what happens in our body and we get cancer. Okay, so let's understand all that, and then we will see the different types of cancers, how they are classified, then what are the different types of treatments, and how the dose is calculated. All those things I will take you through, right? So we'll begin with the what is cancer, and then proceed. You can see my slides? You're able to see my slides? You all are able to see the slides? Can you see my slides? You are able to see my slides? Slides? Can one of you all tell me you are able to see my slides? Please, one of you all unmute and tell me you can see my slides.
Hello, madam.
Can you see my slides?
No, we didn't see you.
No, you are not able to see the slides. Okay.
Yeah.
Now can you see?
Yeah.
Okay, great. Right. So I was talking to you about the study of cancer is called as oncology. Now I have broken up my presentation in basics of oncology in two parts. Okay, so the first part is all about talking about what is cancer and things like that. Right. Now see, every day in our body there is wear and tear of cells. Every day some cells die and some new cells are being formed. Now these cells die because of the natural process. They live their normal life and after that they die. Some die because of if something goes wrong in our body, so these cells die. So every day the cells which are dying have to be replenished. Okay, so every day new cells are also being formed. So some cells are dying, some cells are getting matured, and some cells are getting formed. And that's why you have a equilibrium in our body, and the body maintains itself by multiplying new cells, and some cells are anyway dying. So this is a normal process which is happening in the body. But supposing if some cells die and new cells are being formed, but the cells which are getting formed, they continue to form. So instead of the required number of cells, huge number of cells are formed, and somehow we are not able to control. Then a condition arises where a patient can get cancer. Okay, so in these cases, if there is a huge number of production of cells, there are large number of cells growing which cannot be controlled and they keep on multiplying, then in that case cancer can arise. Okay, but if these, not necessary every time it can lead to cancer, but the cells which are multiplying, if they are abnormal and they lose control and they keep on multiplying at a faster pace, then some abnormal lumps will be formed, and then that can be classified as cancer. So every day a balance is maintained in every human being. Some cells die, some cells are formed, so equilibrium is maintained. But if something goes wrong and the cells keep multiplying and that too these cells are abnormal, then cancer can arise. But cancer is such, it's not a very simple thing. Cancer is basically a mix of more than 100 diseases. So when a patient gets cancer or when a person gets cancer, then the patient is not only having cancer, but the cancer arises because there are more than 100 problems which arise in the body and because of which the patient gets cancer. So it's not a very simple thing, it's a complex thing. But what happens if there is uncontrolled growth of cells and these cells are abnormal? They are not normal cells, but they are abnormal cells, then cancer arises. And cancer's nature is it can spread to other parts of the body. That means it is not restricted or localized to one area. It can go and spread to the nearby tissues, it can go and spread to the nearby organs, and it can spread through blood, it can spread through cavities, it can spread through your neurons. So the nature of cancer is it spreads. Okay. Now the word cancer is derived from a Latin word called crab, and around 15,000 new cases of cancer arise every year. But this is a worldwide data. 15 lakh new cases of cancer arise every year. This is a worldwide data. So you all can check the number of cancer patients which are getting diagnosed in Ethiopia. So check from your cancer registry how many new patients are being diagnosed every year with cancer in Ethiopia. So you will get those statistics, right? Just one second. So I was telling you, this normal growth takes place in our body, which is normal. It is required because some cells are dying, so new cells are getting formed. Supposing there is some abnormality supposing a patient gets some kind of infection, right? To fight the infection, also the body has to produce some new cells, and those cells have to be formed, and which is a part of the immune system. Okay, so all this is very normal. But how does this cell growth and division actually happen? Yeah. So how does this cell growth and cell division happen? Cell growth involves two steps, that is, one is cell division and the other is cell differentiation. So for normal cell growth, of course, the cell has to divide. But after the cell divide itself, the cell has to actually understand what is going to be the role and responsibility of the cell. So what will be the structure of the cell. So that process where the cell actually gradually takes up a new structure and takes up a new function and performs a respective function, that process is called as cell differentiation. So we'll see that. So what is cell division? There are, from the name itself, you can understand cell division means the cells multiply. Okay. So there is a process where the cells will multiply from 1 to 2, 2 to 4, 4 to 8, like that. But there is also a process called mitosis where the cells from the parent cell, one cell will divide into two, but it is just half of that, right? So there are two types of cell division. One is meiosis and one is mitosis. What is meiosis? Meiosis actually takes place with respect to reproductive cells. Now, which are the reproductive cells? You have the sperms and the egg cells, which have to be produced, and they are useful only for reproduction. Okay, so this procedure of cell multiplication in the reproductive cells is called as meiosis. Okay, so here from one parent cell, one half cell will be formed. That means when egg cell and when sperms they meet, a zygote is formed. But how do they meet? From one egg cell will divide into two, and one half of it will come, and one half of the sperm will come, and then they mate, and then you have the production of zygote. The meiosis is totally a different procedure. From 1 to 2, 2 to 4, it is not multiplying in that fashion. Here, the two reproductive cells meet and a new cell is formed. So meiosis is altogether a different process, but we will not look into meiosis because our major focus will be on the normal cells, the somatic cells. Now, what is mitosis? The cell division which takes place in all the cells other than the reproductive cells, those are called as somatic cells, right? So, all the cells other than the reproductive cells in our body are classified as somatic cells. So, the cell division in somatic cells is called as mitosis. And what is the difference? In mitosis, from one cell you have two daughter cells. Then these two daughter cells will form four cells, and from four they will form eight. Okay, so here they keep multiplying like that. So this is entirely a different process of which here, and this is called as mitosis. We will understand mitosis in a way where you will understand what is the procedure and how actually it happens. So in mitosis, from one parent cell, two daughter cells are being formed. Now, what are the phases in mitosis? In mitosis, there are 5 phases. You have the G1 phase, where the cell proteins which are required for DNA synthesis are being formed. Why DNA synthesis? Because in the next phase, that is the S phase, there the DNA duplication or the DNA synthesis takes place. So first in the mitosis, what happens is the DNA will duplicate itself or DNA synthesis takes place. But for the DNA synthesis to take place, the cell has to prepare itself. How does it prepare? It will make the proteins which are essentially required for DNA synthesis. So that it happens in the G1 phase. So in the G1 phase, you have the proteins which are required for DNA synthesis, they are being formed. Now, next phase of mitosis is the S phase. Here, the DNA duplication takes place. So, with the help of the proteins which were the essential proteins which were formed in the G1 phase, the DNA duplication takes place. So, in the S phase, you have the DNA duplication. Now, what happens in the G2 phase? Again, the cell will prepare itself for the M phase. M phase is the actual mitosis phase where from one parent cell, two daughter cells are being formed. Okay, first the DNA has duplicated itself, but the cell has to divide and form into two, right? So that is the M phase. But that M phase has got so many steps, the cell has to prepare itself. So in the G2 phase, the cell will make some special proteins which are required for the M phase. And in the M phase, the special proteins which are required, one second. Yeah. So in the M phase, the special proteins which are formed in the G2 phase will be utilized. And with the help of these proteins, what will happen from the parent cell, the entire cell organelle will divide into two, will duplicate itself, will divide into two. And how they divide basically, then what will happen is the genetic matter will go on two sides of the cell. Okay, and with the help of the centromere, the genetic matter will be pulled to two different sides, and in between there will be a split in the cell. Therefore, from one parent cell, you will have two daughter cells being formed. And what is the G0 phase? Now the cell has duplicated itself, two daughter cells are formed. The two daughter cells which are formed are identical to the parent cell. Their composition, their cell organelles are exactly identical to the parent cell because they have been formed from the parent cell itself. The parent cell has just divided itself into two, and because of which we have two daughter cells, right? So they are exact duplicate or exact replica of the parent cell. Then you have the G0 phase, which is called as a resting phase. Here what happens is, after the cell mitosis, the cell can actually rest itself because it has undergone the 4 phases of the cell mitosis. So it can rest itself for some time. Or some cells will not rest, but they will again go back to the G1 phase. So they will again start multiplying. Okay. The cells which are in the G0 phase, they are present in the resting phase. Now here what happens is these cells can, okay, I'll explain. These cells generally go under cell differentiation. I will explain you what is cell differentiation. So if you see the cell cycle here, you can see you have the G1 phase. Okay, from G1 phase, you have the S phase where the DNA synthesis takes place. Then the cell prepares itself for the M phase. So you have the G2 phase. And in the M phase, you have the actual mitosis taking place, where from one parent cell, 2 daughter cells are being formed. And after the M phase, the cells can go to the G0 phase, or again they can enter the G1 phase. Yeah. Differentiation. Fine. One or two slides missed. Yeah. So I was just explaining you in the G0 phase, some cells will stay back and will not multiply. Right. So what happens? Why do they remain in the G0 phase? Why these cells remain in the G0 phase? After the cells have duplicated themselves into 2 daughter cells, some cells know what they have to do, what is their function. But most of these cells have to take up a new structure, and because of which they can start performing their function. Otherwise, what will happen in a human body? From one cell, you're getting 2 cells. Supposing a neuron multiplies and it produces 2 more neurons. But if it is a neuron, then it is fine. But if it is a basic cell which is being formed, after cell multiplication, they will not know they are going to form which type of cell. Whether they will form a lung cell, or they will form a neuron, or they will form a blood cell, they don't know. So what happens in this G0 phase? They gradually they will change their structure, and after they change their structure, they will start performing a specific function. So first you have a basic cell which is being formed, which is called as a hemato. If it is a blood cell which has to be formed, then first the hematopoietic cell will be formed, or the stem cell will be formed. Now from this stem cell, it will change its structure, and after changing its structure, it will gradually take up the function, like it may form a RBC, or it may form a WBC, or it may form a platelet, right? So in this G0 phase, what happens? Gradually, the cell will take up the new structure, it will take up the new function, and will start performing in the respective manner. That's why you have so many different type of cells in our human body. We have the eye cells, we have the brain cells, we have the lung cells, we have the neurons, we have the blood cells. You know, we have so many different type of cells. But why do we get so many different type of cells? Because of this procedure called cell differentiation. These cells differentiate and then they form different type of cells. So some cells which remain in the G0 phase, they will rest and they will take up new structures and take up new functions, and they start performing in that specific way. Right after uh, they have become a specialized cell, they can again multiply, or they can remain in the G0 phase also, right? So this is how cell mitosis and cell differentiation that take place in our body, right? Now, uh, second, just once. right? So I've explained you what is cell differentiation. Cell differentiation is a gradual process by which a cell changes its structure so that it can perform a specific task. Cells can range from poorly differentiated to well differentiated. So we saw in the G0 phase, the cell undergoes cell differentiation, right? But when we start the differentiation process, so some cells who are just starting the differentiation process, they are called as poorly differentiated because they have still not become new cells. So they are poorly differentiated. But in the same group of cells, there will be some cells who have started taking up new structures and new functions, but not fully developed. So they become moderately differentiated. But there'll be some cells who have taken up the new structure, the new functions. So those cells are called as well differentiated, right? So you have two categories of cells. You'll have poorly differentiated cells. You'll have moderately differentiated cells, and then you'll have well differentiated cells. Okay. So, but there is a quality of each type of differentiated cells. So we try to understand that. So cells can range from poorly differentiated to well differentiated. Poorly differentiated cells are capable of acquiring new functions and are called as stem cells. See, these poorly differentiated cells are not fully developed. So therefore, they'll be acquiring new functions, right? And these are called as stem cells. They are not fully developed. They are poorly differentiated. Therefore, they are called as stem cells. These poorly differentiated stem cells proliferatively rapid. What do you mean by that? So these cells are not fully developed. Okay, they have not fully taken up the new structures or the new functions. They are still stem cells. But since they are not fully differentiated, they can multiply very fast. Okay, because they can again enter the cell mitosis and start multiplying. But you will have the moderately differentiated cells who are in between. So their multiplication also will be moderate. But the cells which are fully differentiated, they are well differentiated cells. That means they have taken up new structures, they have taken up new functions, they know what is their new job responsibility, new roles. So they are fully differentiated. That means they are well differentiated. So these cells will not multiply fast. So they are called as low proliferative. What do you mean by proliferation? Proliferation is multiplication of cells, right? So low proliferative means the multiplication will be slow. So well differentiated cells will multiply slowly, whereas poorly differentiated cells will multiply fast. Moderately differentiated cells will multiply in a moderate fashion. Okay. So why are we trying to know this or learn this? Because this is essential for understanding cancer. If proliferation is unchecked, if the cell multiplication goes unchecked, especially in this poorly differentiated cells, which are multiplying very fast, if it is unchecked means we are not able to control it, or if the human body is not able to control it, then a condition can arise called cancer. So these poorly differentiated cells have the chances of turning into cancer because their multiplication is very fast. Yeah. And if we know in a type of cancer, you have poorly differentiated cells, that means that cancer is going to multiply very fast. If you have well differentiated cells in that type of cancer, that means that cancer is going to multiply very, very slowly. Hello, you all are able to understand and see everything? I hope I'm clear. I hope all of you all are able to understand.
Yes, madam.
Okay. I hope I'm not fast.
You are not.
So I'll continue at the same pace, right? Yeah. If at all you have any query, you all can interrupt in between, yeah. So basically, this diagram will show you that from stem cells, new type of cells are getting formed after cell differentiation. So some get converted to liver cells, some become intestinal cells, some become cardiac cells, some become your RBCs or nerve cells or muscle cells. Okay, so this is how is the cell differentiation procedure. Okay, so that's why it's important for us to understand cell mitosis and cell differentiation. So before cell differentiation, we saw cell mitosis. Okay, in cell mitosis, we saw that there are 5 phases, right? And in each phase, what happens? But why did we study that? The reason for studying the cell mitosis was the chemotherapeutic drugs. That means the chemotherapy drugs that we'll be studying, these drugs are active on the different phases of cell mitosis. Yeah. So if you see a cancer will be heterogenic in nature. That means in cancer you will have some cells which are in the G1 phase, some cells will be in the M phase, some will be in the G2 phase. All the cells obviously will not be in one phase, right? So cell is heterogenic in cancer is heterogenic in nature. So now when you're giving chemotherapy drugs, they some drugs will act on one particular phase, like some will act on the M phase, some will act on the S phase, some may be on the G0 phase, some will act in the G2 phase, right? So the drugs which act on one particular phase, they are called as cell cycle specific, right? And the drugs which act on all the phases of the cell cycle, they are called as cell cycle non-specific. So certain cell cycle specific versus non-specific, certain chemotherapy drugs require cells to be in cycle for activity. That means they are not resting. Cell cycle specific, most active against cells in a specific phase. Okay, on one particular phase. Therefore, they need prolonged exposure or repeated doses. See, as I told you, cancer is heterogenic in nature. So there'll be cells in different phases. Supposing we are giving a drug which is going to act on the M phase. So when the chemo drug is given, all the cells which are present in the M phase will die. But what happens to the other cells, right? So then either you give another drug or you wait for the other cells to come in the M phase. So you will have to repeat the dose. So the cell cycle specific doses have to be repeated. So after a span of time, again you will repeat so that all the cells come in the same phase. So you will have to repeat it again and again. What happens in cell cycle non-specific? Most effective against actively dividing cells, but also effective in G0. So cell cycle non-specific means they are active against all the cell cycle phases, including the G0 phase, right? So here, these drugs you can give, when you are giving this drug, it will kill all the cells present in the cancer. So these drugs are very good, in fact, because when you have a cancerous growth, cells are in different phases. So by giving cell cycle non-specific drug, you can kill all the cells because all these cells are present in different phases. So that means this drug is very good. So all the drugs should be cell cycle non-specific. But generally it is not so. All the drugs are not cell cycle non-specific because of the side effects that they have. Right? So these drugs which are going to act on all the phases of the cell, they have heavy toxicities also. So because of that, their usage is limited. So you can give a limited quantity and it is always given along with any other drug, right? So with cell mitosis, you can understand that it happens in a phase manner. And because we know what is cell mitosis, we can understand that the chemo drugs act on one particular phase, then they are called a cell cycle specific. If they act on multiple phases or on all the phases of the cell, they are called a cell cycle non-specific. So with this cell cycle specific and non-specific, we can understand why we have studied cell mitosis. That's why it's very important for us to understand cell mitosis, which will help us in understanding the chemotherapeutic drugs also. See, here you will see, just 1 second. Yeah, sorry. So basically, here you will see cell cycle specific versus non-specific. Now see, you have the G2 phase. See, this is the G2 phase. Drugs like bleomycin, actinomycin, which act on the G2 phase or between G2 and M. When they will act on the G2 phase, they will act on the M phase, and when the cells are going from G2 to M, they will act on that also. Then there are some drugs which are acting on the S phase. This is the S phase, where the DNA synthesis or DNA duplication takes place. So antimetabolites like cytarabine, doxorubicin, 5-FU, hydroxyurea, they act on the S phase. Then you have the G1 phase. You see drugs like aspergillase, corticosteroids. So different drugs are going to act on different phases of the cell. But there are some drugs which act on all the phases of the cell, like cell cycle non-specific drug. We have temozolomide with us, which is an alkylating agent, right? So these drugs will act on all the cell cycles. So this is the reason why we are understanding what is cell cycle specific and what is cell cycle non-specific. So after understanding this, let us understand what exactly, why exactly cancer arises. See, one process we saw was you have cell differentiation. If cell differentiation goes unchecked, then also cancer can arise. Yeah. And I was telling you that in every human body, there is an equilibrium or a balance maintained. And that's why you will see that some new cells are being formed, some die, there is wear and tear. This is a normal procedure. But if this normal process is not there, so the new cells which are getting formed in our body, if they keep on multiplying or if they keep on growing, then you may find that today the person's height is 5 feet 1 inch, tomorrow the person becomes 5 feet 3 inches, and suddenly 5 feet 5 inches, because the cell multiplication is going on. Okay, a person has got hands which are of the equal length, but if cell multiplication goes on, it might happen that a person may have one long hand, one small hand, but that doesn't happen. Okay, generally your height, your weight, all your organs, they all remain the same. Why? Because there is an equilibrium, there is a balance maintained in the body. But how that happens, we need to understand, right? So if you could traverse a cell at the molecular level, you will see multiple receptors of different shapes and sizes which protrude out from the cell surface. So there is a procedure called contact inhibition. This contact inhibition is a procedure which actually helps in maintaining the balance in the human body for cell multiplication. Okay, but what happens in contact inhibition? Contact inhibition ensures that mitosis and differentiation should not go unchecked. That means cell multiplication and cell differentiation should not go unchecked or should not go haywire. So it keeps the control, right? So here you can see in this diagram contact inhibited monolayer of normal cells. So these are the normal cells which have formed, but multi-layer of uninhibited cancer cells. So here you have an uncontrolled way of growing, so this is leading to cancer. Okay, so this multiplication goes on and on and on, and it is not checked. So here there are chances that it can become cancer. But what actually happens? When cells make contact with other cells, they simply stop growing. This is a normal process. When the cells are coming in contact with the other cells in the liquid medium, they stop growing. But why? Because these contact between the cells will trigger the release of growth inhibitory factors. Now, these growth inhibitory factors are important. Like you have the growth factors which bind to the receptors and they help in the growth and the multiplication of the cells, right? But growth inhibitory factors are there to keep a check so that the cell multiplication and the cell growth stops. So these growth inhibitory factors get released. When these two cells are coming in contact, the growth inhibitory factors are released, and because of which the cell multiplication stops, right? So this is a normal process which happens in every human body. But if this does not happen, and this process is called as contact inhibition. When these two cells are coming in contact with each other, growth inhibitory factors are being released, so the cell stops multiplying further. So this is a normal process. So this is called as contact inhibition. But if something goes wrong in the human body and these growth inhibitory factors are not released, even the two cells are coming in contact with each other, that means that there is something wrong, and if these growth inhibitory factors are not getting released, the cell multiplication will continue. Okay, and if the cell multiplication continues, you can understand there will be huge number of cells being formed, and if these huge number of uncontrolled cells are being formed, that can lead to cancer. Therefore, this contact inhibition is very important for us. In every normal human body, this process occurs, but if it goes haywire, growth inhibitory factors are not being released, then cancer can arise. That's why we are studying this contact inhibition. Right. So we have studied about what is cancer and the different ways in which it multiplies, that is cell mitosis, and you have mitosis and you have meiosis, and we have studied about mitosis, which is the cell cycle and what happens in each cycle, and why we have studied that, because the drugs act on each and act on different phases of the cell cycle, or some act on all the phases. So it's important for us to study. And we have also studied about cell differentiation, because new cells are being formed only after they take up new structure and functions, right? So it was important for us to understand, and if cell differentiation goes unchecked, cancer can arise. And there is also a process called contact inhibition in our body, which helps in maintaining the equilibrium. And if this contact inhibition does not happen, or it gets hampered due to some abnormality, then obviously cancer can arise. So we have studied all this till now. Now, the study about tumors. See, I've been telling you cancer is basically abnormal growth of cells, right? So every cancer, when it begins, initially there are some abnormal cells which are there. Later on, you'll have huge number of cells, huge number of abnormal cells. So when when these cells are in the beginning and some abnormal cells are being formed, but if they are localized to one area, okay, if these abnormal cells are localized to one area and they are not invading the nearby tissues, okay, and not causing much of a damage, and they are encapsulated, that means they are present inside a capsule. Here you will see they are encapsulated, then it is called as tumor. Okay, so basically when any cancer arises, initially you will have abnormal cells, and when they form these abnormal cells, when they form lump, they are called as tumor. So tumor is a lump of abnormal cells, but the tumor not necessarily is cancer. Why? We'll understand that. So all the cancers begin with the tumor only, right? If it is in the solid, if it is a solid cancer, they are initially a tumor. So by basically tumor is abnormal cells. So a lump of abnormal cells form tumor. But this tumor, till the time it is localized, now here if you see the diagram, till the time it is localized and not invading the nearby tissues, and also it is encapsulated within the capsule, it is called as benign. That means it is localized to one area, or it is only present in one area or one part, and it is not affecting any other part or any other tissues around it. But if you see this diagram, you will see this malignant tumor. Here you have the abnormal cells, but the capsule is not there, it's broken. The cancer cells are coming out. That means they are invading the nearby tissues. So this is called as tissue invasion. They are invading the nearby tissues, and they can go and start multiplying in any other organ. Therefore, this tumor is called as malignant tumor, or this is actually cancer. The benign tumor is not cancer because benign is localized to one area. Okay. But malignant is not confined to one area. It is affecting the nearby tissues. It is affecting the nearby organs. Okay. And it is not well encapsulated. And it can spill over. See, these cancer cells are spilling out. So this is a malignant tumor, and this malignant tumor is also called as cancer. So this is about benign tumor and malignant tumor. I hope you all are able to listen and see my slides. All of you can see and hear my slides. I'm not able to see
Yes, we.
anyone. Okay, okay, great. Fine. I'll continue. I'll continue. Yeah. Okay. So we just saw what is benign tumor and what is malignant tumor. So there are three characteristics of malignant cells. Malignant cells are the ones which are present in the malignant tumor or in cancer. So these three characteristics differentiate the malignant cells from the normal cells. So which are those three characteristics? One is structural abnormality. Now these malignant cells or these cancer cells definitely will be different in structure. So there is some or the other structure abnormality. So what is that structure abnormality? Basically, in every human body, we have 23 pair of chromosomes. So in malignant cells, you may have 22 pair of chromosomes, or you may have 41 pair of chromosomes. So either they will be more or less, or the structure will be different. So this is called a structural abnormality. So there is some or the other structural abnormality in the malignant cells. Now, every human cell has got a nucleus inside the cell, which acts like the brain of the cell, and it has got a nuclear membrane. But if there is a structural abnormality, instead of one nucleus, there might be multiple nucleus, or the nucleus may not be present. Nucleus has got a defined cell, has got a defined nuclear membrane. Cell has got a defined cell membrane. It might happen that these malignant cells don't have the nuclear membranes, or don't have the cell membranes, or they are abnormal in nature. So these are the structural abnormalities present in the malignant cells. So some or the other structural abnormality will be seen in the malignant cells. Then one most important aspect is tissue invasion. Tissue invasion is local spread. Now, what do you mean by local spread? That means it affects the nearby tissues. First, it will invade, or it will reach the nearby tissues where the cancer arises. It arises at one particular site. So the tissues which are present around that cancer, that is the nearest tissue. So these malignant cells will first go and spread or invade themselves to these tissues. So that is tissue invasion. So from the primary origin, from where it started, it will first invade the nearby tissues. So that is called as tissue invasion, and it is also called as local spread. Then lastly, you have metastasis, that is distant spread. What do you mean by that? That means the distant means it will spread not only to the nearby tissues, it will go and spread to some other organ. Now, we always see in cancer that the patients, we get to hear then that the patient is in the metastatic stage or the cancer has spread. So what do you mean by that? If the cancer has spread or it is in the metastatic stage, it means that from the place where it originated, say for example, breast cancer originates in the breast, but after some time, because the spread has increased, it goes to the brain, or it can go to the lung, or it can go to the chest also, or the bones around the breast or in the chest cavity also. Okay, so that is metastasis. So from breast, it has gone and spread to the brain, it has gone and spread to the lungs, or it can go and spread to the liver. So that is called as metastasis. Metastasis is distant spread, and it is basically from the primary origin where the cancer starts, it goes and spreads to some other organ. So that is called as metastasis. So these are the three characteristics of malignant cells. Okay, I've explained you structural abnormality, tissue invasion. So this is how tissue invasion is. These are the tumor cells. They are invading the nearby tissues. The basement membrane goes inside, goes to the extra cellular matrix, then it goes to the endothelial, then it goes to the blood vessel. So this is tissue invasion. So from the origin from the place where it originated, it goes to the nearby tissues, and then later on it can even enter the blood vessel. Yeah. Here you can see the difference between benign and malignant. See, what you see here is a benign tumor. What you see here is malignant. So this is fully encapsulated. That means it has a cover. It has a you can say a membrane kind of. Sorry. This is well encapsulated, and it is localized to that area only. Yeah. Whereas if you see malignant, its shape and structure is such that it does not have a proper boundary or is not encapsulated, and it is going and spreading anywhere. You can see the structure is such that it can invade anywhere. Plus it is bigger in size. Yeah. So basically benign tumors are generally small, well demarcated means have a proper boundary, have a proper capsule or a membrane. They are slow growing. They are non-invasive. That means it will not invade the nearby tissues. Non-metastatic, it will not go and affect any of the nearby organs. Well differentiated means the cells which are present inside know their job and they know their roles and responsibilities. So they will they are fast, they are well differentiated with new structures and everything. Therefore, they will not multiply fast. They are poorly multiplying cells. They are poorly proliferative cells. So this is what we study. Whereas here what will happen is, sorry, yeah. So here what happens is, this is large in number, large in size, poorly demarcated, does not have a proper boundary, rapidly growing with hemorrhage and necrosis. It multiplies very fast. Locally invasive, it is invading the local tissues. Metastatic, it goes and spreads to the other organs. It can spread to the ovary, it can spread to the fallopian tubes, it can go and spread to the uterus, anywhere for that matter. And poorly differentiated means they are cells which have fully not, which have just started their differentiation procedure. Since they have just started the differentiation procedure, they are poorly differentiated, and that's why they can multiply very fast. So they can take up a new structure and function and start multiplying very fast with the new structures, right? So therefore they are called as poorly differentiated cells. The difference between benign and malignant tumor. So characteristics, and then you have the benign and the malignant tumor. Just 1 second, I'll just put this off. Just give me 2 minutes, just 1 second. The difference between benign and malignant tumor. Different in benign tumor is are well differentiated, malignant are poorly differentiated. Benign tumor, they multiply slowly, malignant tumor multiply very fast, so it's rapid. Local invasion, benign tumors are localized and they are covered by a capsule, whereas malignant tumors, no capsule, spreads to the nearby structures. Metastasis is absent in benign tumors, whereas it is present in the malignant tumor. Metastasis means it is going and spreading to some other organ, right? So that is absent in benign, but it is present in the malignant tumor. Yeah. So we saw the characteristics of cancer cells. Yeah. And now we understand the different classifications of cancer. See, cancer is broadly classified under 4 classification, that is carcinomas, sarcomas, hematological cancers, and central nervous system cancers. So we'll understand each one. See, basically, carcinomas, they arise in the epithelial layers. They actually arise in the epithelial cells. Example is skin, breast, lung cancer. The adenocarcinomas are the ones which arise in the glandular epithelial tissue. So basically, they start in the glandular epithelial tissue, which line the internal organs, and it makes and releases substances in the body like mucus, digestive juices, and other fluids. Okay, so basically, it is the glandular internal lining of the organs which actually secrete various types of substances like mucus, digestive juices, and your other fluids. So when it arises in the glandular epithelial tissue, it is called as adenocarcinoma. Example could be even your breast cancer, your prostate cancer, kidney cancer. So all these come under the classification of adenocarcinomas. Then actually you have, which is not here, you have the sarcomas. Sarcoma begins in the connective tissues. You know which are the connective tissues like your muscle, bone, fatty tissues, tendons, all these are your connective tissues. So when the sarcoma originates in the connective tissue, then it is called as sarcoma. And when cancer originates in the epithelial tissues, it is called as carcinomas, right? Example of sarcomas is uterine sarcoma and Ewing sarcoma. Uterine carcinoma are of course seen in the uterus. Ewing sarcoma are the ones which are seen in the bones. Yeah. Then you have the hematologic cancer. This is basically, if you see hematological cancers, they are classified as lymphoma and leukemia. Now, lymphoma is basically affecting the lymphatic system of our body. Lymphatic system has got Basically, like you have the blood circulatory system, you also have the lymphatic system. The lymphatic system is basically like a immune system of our body. It helps our body to fight against infection. So like how you have the blood circulatory system, running all throughout our body, and it goes to each and every cell. Same lymphatic system also runs parallelly to the blood circulatory system, and it goes to each and every cell, and it picks up all the waste, removes all the waste, and also helps body fight infection. Okay, so if the cancer originates in the lymphatic system, then it is called as lymphoma. You have two types of lymphomas. You have Hodgkin lymphoma and non-Hodgkin's lymphoma. Okay, Hodgkin's lymphoma originated from the Hodgkin cells and was a type of specific cells. Therefore, it is classified under Hodgkin's. And the Reen-Steenberg cells. If it starts in the Reen-Steenberg cells, then they're classified as Hodgkin's lymphoma. But if this cancer arises in the Reen-Steenberg, if it does not arise in the Reen-Steenberg cell, then it is called as non-Hodgkin's lymphoma. Okay, so that is lymphoma. And even in Hodgkin's and non-Hodgkin's, you have multiple classifications. Yeah, but also you have lymphoma and you also have leukemia, which comes under hematological cancers. Now, what is leukemia? We generally say it's a cancer of the blood, right? But what actually happens in leukemia is the WBC counts go very high, because of which the body is not able to perform, and these WBCs which are going on a higher side, they are all abnormal, right? Therefore, since abnormal WBCs are there, they are not able to, they don't have the WBCs which are required. Now, if the WBCs are not present, the body cannot fight against any infection, cannot protect itself. So it's a very dicey and a tricky situation. So here the WBC counts go very high. Now, leukemia is also classified under 4 classifications. You have chronic lymphocytic leukemia, you have chronic myeloid leukemia, you have acute lymphocytic leukemia, and you have acute myeloid leukemia. So basically, leukemia is classified into 4. If the cells involved are the myeloid cells, then it is called as myeloid leukemia. If the cells involved are the lymphoid cells, then it is called as lymphoid leukemia or lymphocytic leukemia. And these leukemias, if they start suddenly, then they are called as acute leukemias. If they take a very long time to develop, then it is called as chronic. So you have acute lymphocytic leukemia, acute myeloid leukemia. You have chronic lymphocytic leukemia, you have chronic myeloid leukemia. I'll be taking leukemia in detail when I take up imatinib product tomorrow. Yeah. Then you have the cancer arising in the CNS cancer, arising either in the brain or spinal cord. So these central nervous system cancers arise in the brain or spinal cord. Example could be our glioblastoma multiforme, astrocytoma, and even glioma. Okay, all these are arising in the brain only, but in the different cells of the brain. Now let us see what are the causes of cancer. We all know, we don't have to list out the causes of cancer. Could be genetic, environmental, and virus related. Basically, genetic means you don't inherit cancer from your parents. Yeah, but you are genetically, you can be predisposed. So what do you mean by that? You are not a carrier of cancer, but if the child whose parents had cancer comes in contact with some carcinogenic agents, then the chance that he or she gets cancer will be very high in comparison to a child or a person whose parents have not got cancer. Okay, so that is genetic predisposition, and that's why we say it is not inherited, but it can be, you can be predisposed to these carcinogenic agents, and because of which you can get cancer. So the chances are very high. Also, there are different type of genes which are responsible for cancer. So if some abnormality happens in these genes, then the patient can also have cancer, right? Uh, Environmental factors are many. It could be your diet, your eating and chewing habits, like some people chew tobacco, some people drink alcohol. So all these come under environmental. Also, some people work in certain industries which are where it's very difficult to remove the environmental hazards. Like if some people are working in the asbestos factory. Asbestos is a very hazardous chemical. If you inhale, then the chances that you may get lung cancer are very, very high. Some patients or some people work in the nuclear reactors, right? If they don't take proper protection while working in the nuclear reactors, then they may get type 1 or some type of skin cancer or any other cancer also. Okay. And even people who are more exposed to UV light, they also have chances of getting cancer. So environmental hazards are many. Then you have viruses. Basically, some of the viruses are also responsible for cancer. So some of the viruses are also responsible for getting cancer, like the uterine cancer, the cervix cancer basically arises because of human papillomavirus. The human papillomavirus is the main causative agent of causing uterine cancer. So some of the viruses are also responsible for causing cancer. The HIV virus, which is present, can also lead to a condition called as Kaposi sarcoma, which is also a type of cancer. So basically, different viruses are also responsible for different types of cancers. But in some countries, even in India, for cervical cancer, where it is the chances that a female might get cervical cancer if they are high and she's below 21, then they can take a vaccine also. So below the age of 21, you have a vaccine for cervical cancer. The patients who have taken the vaccine, he or she may not get cervical cancer. So for various type of cancer, there is a lot of research going on. So new and new even injections and therapies are coming where they can actually prevent the patient from getting cancer which arises due to virus. So that work is still going on. So once that is released, we'll of course share that with you, right? Now, how does cancer spread? It's the spread of tumors could be direct. Okay, so direct means from the place where it originates, it goes and spreads to the nearby organ. There is a tissue invasion. Then you have lymphatic spread. It can spread to the lymphatic system. That means to the spleen or lymphatic vessels or lymphatic fluid. Then through bloodstream, that means the blood circulatory system also it can spread. It can spread within the body cavities. Supposing it arises in the large intestine, it is tubular in nature, so it can go all across the intestine or across the small intestine, that way, spreading through the cavities. Yeah, now let us understand what is primary and secondary tumor. I have been telling you where the tumor, when it arises, from the place where it arises. So that site where the tumor originally started is called as primary tumor. Okay, now when this tumor breaks off and it goes from the original site to a place where or to other parts of the body, then it is called as secondary tumors. So from the primary tumor, supposing it started in the lung, okay, but it goes to the brain. That means when it is going to the brain, you have metastasis in the brain, and when it is in the brain, then brain is called as a secondary tumor. That is clear. When it goes to the other organ, it becomes secondary tumor. So what are the cancer's symptoms? There are 7 warning signs of cancer. I'm sure all of you know, but I'll just quickly run through this. If there is thickening or lump in the breast or any other part of the body, then the chances that patient may have cancer. So these cancer symptoms or the 7 warning signs of cancer are not necessarily meaning that if you have this, you're going to definitely have cancer. But these are the warning signs. Okay, so if you have any of these problems, it is better to investigate. It is better to get yourself screened. So thickening or lump in the breast is something that you should be worried of. Obvious change in a wart or mole. You have wart and moles around neck area and all that. So if there's any sudden change, you should get it investigated. If there's a sore that does not heal for long, you should get it investigated. Nagging cough or hoarseness. If you have continuously you keep coughing and your voice is becoming is hoarse, then definitely you should get yourself investigated by a chest physician. If there's a change in bowel or bladder habits, then also if there's indigestion or difficulty in swallowing food, then also you should check. If there's unexplained changes in weight, okay, that means suddenly if the weight gains, if a person starts gaining weight suddenly, or if the patient starts losing weight suddenly and without any known reason, then that is a cause of worry. Unusual bleeding or discharge. If there is unusual bleeding or discharge, then even that should be investigated. By unusual bleeding or discharge means if you get a hurt, but instead of the small bleeding, if the bleeding is more, then that means it's unusual. Okay, or if there's a small wound or a cut, if there is discharge, which is which occurs generally in places, especially in the cases of females, there could be some type of discharge which is unwanted and it smells, so in that case, it is better to get it investigated. So these are the 7 warning signs or symptoms of cancer. Okay. Now, if a patient complains any of the symptoms which we saw in the 7 warning signs, then screening is required. And obviously, screening is also required in patients who cross 40, right? They should investigate themselves. Even today, it is recommended beyond the age of 30 also, you should get yourself screened. So there are certain simple common tests that everyone should do to keep a check if at all he or she gets any other disease or not. Yeah. So what is screening is checking for cancer or for conditions that may lead to cancer in a person who does not have any symptoms of the disease. Maybe symptoms are not there, but you have to screen to check whether the patient is having cancer or not. So which are the specific tests? One is if it is for females breast cancer, then mammogram, obviously that's a type of X-ray which is done for female cervix. You have the pap smear test. With the help of the brush, you remove the cells and send it for histopath report and see if there are any abnormal cells present or not, right? Then you have for colon and rectum, you have digital rectal examination. The doctor will insert the finger and check if there's any abnormality. Fecal occult blood test means you check if there are any stains of blood in the stool. Sigmoidoscopic S-shaped endoscope is inserted from below to check if there's any unwanted growth or if it is colorectal cancer only. Then you have the barium enema. Barium enema is here patient is given barium sulfate. Patient is made to drink barium sulfate, and after the patient drinks barium sulfate, then on the screen they will monitor where all the barium sulfate is going. Because they use barium isotopes in barium enema. So wherever this barium isotope goes, they will understand that it is cancer, and then they will start the treatment accordingly. You have some of the routine laboratory tests which are done to see whether the patient has got cancer or not. So there are some blood or urine tests which have to be done to see whether the patient has got cancer or not. So there are some tumor markers. So each cancer is associated with tumor markers, with 1 or 2 tumor markers, and then If those tumor marker levels are high, then it's indicated that the patient may have that type of cancer. The tumor markers are substances made by cancer cells or by normal cells in response to cancer in the body. So sometimes the cancer cells only will produce the tumor markers, that means the chemicals or the substances, or sometimes cancer cells, the normal cells will also start making, they will start making when you have the cancer cells around them, right? If you have cancer cells around those around the normal cells, sometimes the normal cells will start producing these tumor markers, right? So some tumor markers are specific to one type of cancer. So one tumor marker is related to one type of cancer. Like for example, if the CEA levels is high, then the patient may have colorectal cancer. If you have CA 125 levels which are higher, then you have ovarian cancer. If the PSA level, that means prostate specific antigen test, if this level goes high, it's an indicator that the patient might have prostate cancer. Like that, if thyroglobulin levels go high, it can indicate that the patient has got thyroid cancer. So this is how you have different types of markers for different type of cancer. So what do you mean by that? You have different type of chemicals being released by the cancer patients who are having the different type of cancers. So if those levels are higher, then the patient will have to go and investigate on the basis of this, right? So you have the tumor marker test, and you also have the uh, X-rays, and you have the ultrasonography and such things to check whether the patient has got any type of cancer or not. But all these are, I would still say, just indicators. Yeah, because the confirmatory test is your biopsy. The biopsy is the main confirmatory test for cancer patients, right? So even if the patient has got done the blood test, which can indicate that the patient has got cancer, and even if the patient's sonography or X-rays have been done, or any endoscopy has been done, it may show that the patient may have cancer, but the final conclusion is only after doing a biopsy. So what is done in biopsy? In biopsy, a sample of tissues from the body is examined under the microscope to determine if cancer cells are present or not. Always required for the diagnosis of cancer. So this is a confirmatory test and the most important test for confirming whether the patient has got cancer or not. But it does not only talk about whether the patient has got cancer or not, but it is also helpful in showing that after the cells which have been removed, they are sent for investigations. So after they are investigated, the histopathologist will also see that which type of cells are involved, whether they are poorly differentiated, moderately differentiated, or poorly, moderate, or highly differentiated, right? Once they know that, then they can help you in telling that this is a slow moving tumor or this is a fast moving tumor. So they will be able to guide us. So basically, biopsy is very important because it helps us in knowing the type of cells which are involved in the cancer and what is the nature of these cancer cells, right? So it's important to do a biopsy, which is a confirmatory test for cancer. Then there are certain other screening tests. You have first understood that the patient has got cancer, but we have to pinpoint, understand where exactly it is so that the treatment can be planned. So how that is done? By either bone marrow testing or with bronchoscopy or with imaging technique, you find out where exactly the cancer is present, either through X-ray, USG, CT scan, or MRI or PET scan. So only after that you understand where exactly the cancer is present, and then the treatment can be started. So after understanding what exactly cancer is, and how exactly it multiplies. We will have to understand the different staging in cancer, right? So what exactly staging? Careful attempt to find out whether the cancer has spread or not. Okay, so if you have to find the extent of spread, if you have to see the extent of spread, that means how much the cancer has spread. It is small in nature, big in nature, and till where it has spread. That information you will get by staging, and that information is spread by staging. So it provides an important guide to the diagnosis, prognosis, and treatment of the cancer. So staging will help us in knowing the extent of spread, but in which form? There are two types. One is a Roman numeral type and the other is a TNM system. Roman numerals, you have stage 0, 1, 2, 3, 4. Now stage 0 Roman numerals indicate that it is carcinoma in situ. What do you mean by carcinoma in situ? Means it is some abnormal cells are present and still in the very initial phase where only few abnormal cells can be seen. In stage 1, you have this is a localized cancer. It is detected early, which has not spread to other parts of the body and are confined to the site of cancer origin, usually curable. See, in stage 1, it is still localized. That means it has not gone and spread to the nearby tissues or organs. So till the time it is in this stage and the size is comparatively small, then surgery is possible and is purely treatable or purely curable. Stage 2 also cancers have spread to lymph nodes surrounding the site of cancer origin. So cancers that have spread to the lymph nodes from the place where it originated, if you have lymph nodes around the cancer, then if these lymph nodes get affected, then it becomes stage 2. So from the place where it originated plus the lymph nodes around it are also affected. So that is stage 2. But till here also the surgery can be an option for treatment. Then you have the Roman numeral V1, 2, we saw that. Then you have stage 3, renal cancer that has spread to lymph nodes surrounding the site of cancer origin. In stage 3, the cancer comes out, it spreads around the cancer and it also spreads to the lymph nodes, right? So there is tissue invasion and the lymph nodes are also affected. So it is called as stage 3, but even till here, surgery is possible. In stage 4, you have distant cancers that have spread. That means it has metastasized to other parts of the body and are often inoperable. Okay, so it has metastasized, that means it has gone and spread to other parts of the body and it is inoperable. Your surgery is not possible because how will you do the surgery? Surgery is possible till the time it is localized and confined to one area, but if it has gone and spread to other parts, surgery is not possible, right? Therefore, when it goes and spreads to the parts of the body and it becomes inoperable, then then the stage is called as stage 4 or the metastatic stage. We have the TNM system of staging also. This is a different way of staging. I hope all of you are able to understand. Hello?
Yes,
Yeah.
yes,
You are understanding, no?
yeah, we understand.
Oh, good. You don't want a break, no?
Hmm?
Do you want a break?
What's our break?
Yeah. You
Continue.
require a
No, we
break?
can continue.
5 minutes break?
Okay.
Yeah.
No, we can
Let us
continue.
continue.
We'll continue? Fine, we'll continue. Oh.
Mm.
Yeah, so I'm continuing. So you have the Roman numeral type of staging. You also have TNM type of staging. Now in TNM, what happens? You understand the size of the tumor, and how many lymph nodes are involved, plus whether there is metastasis or not. So basically, you will get to understand the same things in Roman numeral and even in TNM system, but only the way you represent that differs. Yeah. So in TNM system, it measures the size of the tumor, and that is designated as T. Absence or presence of cancer in the lymph nodes, that is N. Hello?
Please share the screen.
Oh, sorry, sorry. Now you can see? You can see the screen?
No.
No?
Yeah.
You're able to see the screen?
We are not.
No. Okay.
Hello?
Yeah, now you can.
No.
There is some problem. Just 1 second. What is the issue?
There is some problem.
There's some issue.
Huh?
Yeah.
Yes, madam.
1 second. I'm just facing some technical issue. I'm just trying to resolve it.
Okay. We'll raise you.
Okay, you'll have to just give me 2 minutes. I'll just contact my engineer. There's some issue. Oh, wait. I'll do one thing. I'm just logging you all out. You all will have to rejoin, okay? I'll just try doing that. Please rejoin,
okay.
okay? Yeah.
2 minutes.
Trigger it. Original.
Take us.
Hello, madam.
Now you can see my slide?
Yeah, we can.
You can? Okay, thank you so much. Now we'll start. Recording वापस करना होगा ही दोबारा करना पड़ेगा. How can I know?